Stress. That's what you caused me.
Fair enough.
Yeah.
Fair enough. It's pretty common in most relationships, especially parent-child.
So, what is stress?
Good question. What is stress to you since I cause you stress?
My only thought is overwhelm, but I'm sure we can talk about the difference between stress and overwhelm. And I'm sure there is a difference.
I think there's some similarities and overlaps. That makes sense. They typically define stress as this sort of worry or tension that someone is experiencing, typically about a particular situation. It depends if we're talking about acute stress that's happening in the moment now, sort of a singular type of stress versus chronic stress.
And chronic stress is?
So when we think about acute versus chronic, because that is very important, acute is typically going to be time limited, and it's usually related to a single event. So you've got an exam coming up, you've got a job interview or something like that. And so what happens a lot of times in those types of situations is we experience physiological reactions, sort of a lot of feelings with that, because the other part about stress is that it depends on your ability to cope in those moments too. So is it overwhelming your capacity to cope in those sense? So a lot of times in acute, you're going to ramp up, but then once that event is over, you come back down to sort of your baseline and things are okay again. Versus chronic, which is when people are experiencing chronic stress, they are oftentimes...
And they stay up.
Well, and they go up, or maybe they come down a little bit, but something else happens.
They don't return to baseline.
They don't return to baseline. And so it could be multiple events that are happening in a very short period of time, and those overwhelm their capacity to cope. Or it could be something that's occurring that's long-term. So living in unsafe situations, whether that be in a home or in a community. It could be having an ill loved one, and especially if you're caretaking for them. So whether it's a child or a parent or significant other and you're the caretaker, that can cause a great deal of chronic stress. And so there's lots of different situations that fall in both the acute or chronic, but it is important to distinguish between those.
Okay.
So, when you think about it, especially as you think about teenagers or college students or young adults, what stresses them out?
Everything?
Everything, yeah.
I think stress could be one of those things that's overgeneralized and overused.
Well, I think...
Because everything is stressful nowadays.
Well, and everything has probably always been stressful, right? That's something that a lot of us have in common. It is a normal feeling, reaction, experience, what have you, with that. So when we say everything, obviously we put parents in there.
Parents, school, friends, activities like sports, homework.
Teachers.
I said work, right? I said homework.
Yeah, homework, work.
What are you going to do with your life? That's a big stressor.
Trying to figure out those big things.
Figuring out your life.
Yeah.
Those are very broad, and I'm sure there's more, but that's all I got right now.
I think those are probably a lot of the big ones that I hear, especially working with adolescents and young adults.
Social media is stressful. Yeah, I think that's all the major ones.
And it's interesting. People will say, and I've had, even younger kiddos, 12, 15, say that social media is stressful, but usually they talk about it in a way to cope, that they like it.
Yeah.
So
I don't know what. Yeah.
And I think
that's very true.
It is. It is. And I think that's important to keep in mind, which is stress and how people experience it is very individualized, as well as how people cope. Although there's a lot of similarities for people.
Mm-hmm.
And so we're sort of talking about the in general types of situations.
Mm-hmm.
But those are all pretty standard. And so I think any type of like deadlines, traffic, just getting through traffic sometimes.
I don't get that one.
That it's stressful?
Yeah, I just don't get it. Unless you're like running late. I don't get it. It's not that stressful.
Really?
Yes.
Sometimes there's some drivers.
Sometimes,
but
I don't mind traffic.
And
as long as I'm like not in a major rush, like I don't mind it.
Right. And so then I think this is a distinction between irritations or annoyances and stress.
Yes. Traffic is rather annoying. I don't know that I get stressed out by it.
Right.
Mm-hmm.
But you're right. When you're running late, it feels stressful.
And is it really the traffic that's stressing you, or is it the fact that you're running late that's stressing you?
Mm-hmm. And really doesn't matter because the bottom line is you're feeling stressed.
Yes. But is traffic the problem, or is you being late the problem? What's the problem here?
And you're like, how do we solve this so this doesn't happen again? But you are also one of those types of people who I would probably say seldom is late because
I don't think I'm only late if I'm late on purpose.
Typically, because you are extra conscientious about being on time. Mm-hmm.
I was stressed out on, Monday and Thursday, because I woke up with enough time to go get my coffee before going to practicum, and then I couldn't find my shoes. And I was like, I'm really not getting my coffee right now, am I? Don't worry, I got my coffee.
You got your coffee, because that would have been a long day.
Yes.
Yeah. Yes. But you bring up a really good point, which is this concept, and there's a great video on YouTube, which is your physical reaction to stress, right? Cannot distinguish between a life-threatening event
and being chased by a tiger.
Right? Which would be being chased by that saber-toothed tiger, or I'm running late and I may not get my coffee.
It wasn't the fact that I'm running late. It was simply just the fact that I won't get my coffee.
Which was very stressful because you were thinking, oh my goodness, this is a really long day. Yeah. So, and that is what is when we think about the impact on the body, and we'll talk about the physiological responses, mental health, relationships, all of that. But those are some of the adverse effects of stress that we have to be aware of is what does experiencing this level of stress, what is it doing to my body? And is this helpful in the moment, or is there some things I can do about it so I'm not experiencing stress to this degree? Mm-hmm. Mm-hmm. And some people are surprised by this, but not all stress is bad stress.
Yeah.
There's a word for it. Do you remember it?
Eustress?
That's right.
Eustress.
Yes. So eustress versus distress. Do you want to tell us about that?
Eustress is not technically bad for you, and distress is bad for you. That's what I got.
That's what you got. Yeah. So eustress, because even when there's things that we're looking forward to, mm-hmm. we can feel stressed about them, right? So if you think about getting ready, planning to go to the prom, or, some people talk about their wedding and how stressful that could be. Like, it's something that they're really looking forward to, but it can be stressful. So going on a family vacation, love it, look forward to it. But I know there's going to be some moments that are a little bit stressful in the preparations and getting ready. So eustress is just, it's something that you're looking forward to. You want it. And yet there are stressors associated with it. Whereas distress is usually there's
nothing good about the outcome.
Well,
there's nothing you're looking forward to.
Right, besides having it done, maybe.
Yeah.
Right, that deadline.
Yeah.
That exam. That job interview. Those types of things.
And stress can be transferred.
Tell me more.
You just talked about how planning vacations and getting ready to go on vacations is stressful for you. It's not stressful for me until it's stressful for her.
Yes.
If I didn't have to deal with her, I don't think I'd be stressed about it.
There's a whole lot of things that have to happen to get everybody out the door and
you
happy.
Think about all of those little things, and I'm just like, whatever gets done, gets done.
Yes.
Yes.
And I think it's become less stressful for me in recent years. Well, because you have taken over some of the planning, so it's not all on me. I mean, let's face it. Growing up, you know your dad and your brothers a little bit well now, and even your dad a little bit. How much co-sharing of planning and prepping and those kinds of things? I mean, sometimes
we live to make you happy.
We do, and I love it. It's great. But let's just face it. And your dad's up for anything, but if you asked him where we were going, he may or may not be able to tell you at any given point, because of his involvement or lack thereof in the planning process.
Because he's down to go wherever.
Get down for it, whatever. Just tell him.
You give him the directions and he'll drive.
And he does pack his own stuff. Yes. So that is something that I've never
had to do.
No. I do remember one time, this has nothing to do with this, but yeah, the first time he brought me his shirt to iron.
I think we've talked about this before. What was that? I don't know. I think it was in our situationships episode when we were talking about dating.
It could be. Yeah.
She told him no, that she's not his mom.
My response was, you know where your mother lives.
Yeah.
Once, that was all it took. Now, don't get me wrong. I would be happy to do that. Right? Because this goes in with stress. Many times some of us are running late or we've got some other things we're trying to balance. And that's part of partnership and relationships, which is, oh, hey, I've got time. Let me do that. Or we're both tight for time, but one of us might have a little bit more. So that's divvying the load.
Now you're willing to do it.
Well, I was willing to do it then too, but I'm not going to run around trying to do all of these things and get myself ready while you're sitting down watching television, giving me your shirt.
Anyways.
But I'm always happy to do those things when we're all busy. Yep. So, and he is a great help, which helps manage some of the stressors. And I would say that's a big part of how we've balanced a lot of things when you talk about stress is transferred and so forth, and how much in a home, in a family, can you have going on at any given time when you can plan for it. So that's another thing, is when you're thinking about stressors and how to manage those, there's different ways. And one of those obviously is planning and problem solving. So if we know different things are happening, or what was like with your dad's job, which was seasonal a lot of time, like it would get heavier at different seasons, same with mine. And so we just really tried to balance that out. I knew, him driving for FedEx, like between Thanksgiving and New Year's, I tried to really have no travel or very little, if at all possible, just to balance those things, because the stress was high because of all the other things that needed done in the house, to, whether it's chauffeuring kids, managing dinners, things like that, and so you come up with different ways to try to plan and problem solve for some of those heavier times, those more stressful times, when you can. Not all situations are planned for, though.
Yeah.
And
that's where the distress typically comes in.
Yes. Well, I would even say even with the planned ones, a lot of times, are we able to think far enough in advance? And are we able to, do we have partner or family support who can come in and say, oh, you've got all these going on. Let's each of us sort of pitch in and help in these different ways to make it all happen. That takes some space to be able to think about ahead of time. And it certainly takes supports. And so that's another big part of what can help us manage our stressors, which is those social supports.
Which not everybody has.
Not everybody has. And for some of us, and myself, what?
Nothing. I was just like, and?
Well, I was thinking to myself, and how many of us are not always the best at asking for help?
Yeah, you're really not.
I try to be, or I feel like I am. Like, I think I am when I get to know what it is. But sometimes I think many of us get into these newer situations or take on new roles or new responsibilities.
And you feel like it's all on you.
So yes, until you can get to a point where it's like, hold on a second, this isn't working anymore, or it's not working. Yeah, was it ever? That might be a reflection too. But then it's, or sometimes it's like, is it that maybe you've been asking for help, but there may not be the kind of help that's available, depending in different situations, right? There's a lot of single parent households. We've got a lot of people in jobs experiencing overwhelm and burnout. This is getting very common now. I'm hearing a lot about the overwhelm and burnout especially related to work.
Maybe your stamina is just not that great anymore.
Do you think it's stamina?
I don't know. Motivation? I don't know.
I don't know about that, because as part of Gen X, I mean, like, I love working.
I know you do.
I do. But there can be moments, and a lot of it is, so it's not so much the time, right? As long as it can be balanced with family, friends, relationships, and things that are important, but it's how are we spending the time, right? There's certain things about our jobs. Certainly, I have those about my job I love, revs my engine. And then there are other things that really drain my energy, and too much of those types of things can feel, I don't know, maybe I think they do feel stressful, because again, going back to sort of that tension and like how to get some of these things done, and you're trying to push your way through it. But sometimes if you don't have that balance of the other things that you're enjoying as much, and I think that's where things get a little off kilter.
I zoned out.
You zoned out.
I zoned out. It's okay.
Oh,
it's been one of those days.
It's one of those days. Although, when don't you zone out with me sometimes?
Next question.
I feel like sometimes I'm like, we need to insert the little, what is it, Charlie Brown teacher sort of thing. You don't know what I'm talking about?
No, I know exactly what you're talking about.
And you're like, no.
That's not what I hear. I heard the words. I could probably tell you a few of them. Off-kiltered. I'm pretty sure you said that. You did. Yes.
Yes, I did.
Those were your last words, actually. See, you listen.
You listen. And you don't judge.
Oh, I judge. Moving on.
Me. Judge me. Yeah. So we've talked about eustress and distress.
Yes.
We've talked about acute stress versus chronic stress. We've talked about different examples of ways that people, especially adolescents and young adults, experience stress.
Did you answer my question about what was stress versus overwhelm?
I don't know that I answered that.
Because then I was going to throw in there feelings of stress or feelings of anxiety.
Yeah, I
feel like they can show up similarly sometimes.
Yeah.
Yeah.
So, and there's probably more scientific responses to this, so people can drop those in the comments. But when I think about first making a distinction between a stressor and stress.
Mm-hmm.
So there's lots of different stressors that we
have. But a stressor doesn't always make someone feel stressed.
Right. And so stress is the experience that we have in response to stressors.
Mm-hmm.
And that stress is just typically is just a normal feeling, right? It is, I'm feeling this tension or pressure because I've got this due date, this deadline, this event, this performance. And so there's some stress involved. So that's the tension and the worry. The anxiety, where that tends to overlap, is then you're thinking about the what ifs, right? So I might feel stressed because I'm going to a job interview, and that's a normal tension type of thing. Then the anxiety comes in because I'm like, what if I'm asked a question that I don't know the answer to? What if this? What if that? So that's where the overlap and sort of those distinctions are between that.
Mm-hmm.
The overwhelm is a totally, to me, I feel that's a more intense feeling than what I would say that stress is.
Would you say it's similar, like a similar form to stress? If that made sense.
I think with stress, you may or may not get overwhelmed.
Yes.
Right? I think it depends on your coping skills.
But with overwhelm, you are stressed.
With overwhelm, there's always typically stress.
Okay.
And usually with overwhelm, there's stress that has gone beyond my ability to cope in the moment right now. Okay. So stress, sometimes we're stressed. We know it. It's going to happen. And we know we're going to push through it. This event will occur. And then afterwards, we go back to baseline. And going back to that baseline before the stress is really important. So when you think about what's happening physiologically, right? Go back to the saber-tooth tiger, right? And you're getting chased, caveman days. So,
yeah.
Right? Like your life depended on getting away from the saber-tooth tiger. So when you think about what's happening physiologically in your nervous system, you've got the sympathetic and parasympathetic nervous system. And so you're getting chased and you're kicking into this fight or flight, right? And so you are literally fleeing for your life. And then when you get back to your cave, then you rest, right? It's like this exhaustion comes over you, you rest, and then your body balances itself back out and it goes back to baseline. And so what's happening, especially in our modern world, these moments that we have throughout our day, running late, for this thing, getting this email, trying to think about what is it that I need to do, trying to meet this deadline. And so we have multiple times throughout the day that this stress response is getting activated. And so physiologically, we're going into that fight, flight, freeze mode frequently. And so what happens is then that's kicking in our adrenaline and our cortisol and so forth. And when we're not having enough time to come back and rest, then we're not getting back to our baseline. And then this is when that chronic stress can come in, right? Because we're not getting back to baseline. We keep going. We keep pushing through. Did you zone out again?
No, I have thoughts, but they're like not forming into full thoughts.
We can take a partial one.
Well, so saber-tooth tiger, that's like a major stressor.
Right.
Yes. And so you have that up and then you have that down to baseline.
Right.
But these like daily stresses that you're talking about are like little micro stressors that you go up and you might come down a little bit, but you go up again because you got more and more. Mm-hmm. Yeah.
But think about what's happening in somebody's body when they get stressed.
I didn't mean to throw my eyes at you.
It's just such a habit. We
It
know.
really is. I'm like, you really asked me that question.
Well, whether you're getting chased by the saber-toothed tiger or you're running late, what's happening?
You just had to.
I had to. I'm sorry. I do this in my trainings all the time.
Yeah. Your heart rate goes up.
It does. So your heart starts beating faster.
Yes.
So that's the whole cardiovascular system getting involved there.
My eye twitches.
Okay, so that is, one of your body signals, which it's important for all of us to know what our own body signals are, what's happening when we are getting stressed.
Some people get shaky. Some people sweat.
Stomach upset, very common, right? Some people get headaches, tension headaches, things like that. So our body gives us clues that we're having these different types of tensions throughout the day. And there's certain things that we can do throughout our day to, because I don't know about you, but as for me, for the longest time, you just push it down, keep going, right? You got to get
push it down. Don't feel it. You'll be fine.
That is not advice. It's
a quote from many episodes ago.
And so many people do that, right? We, thinking about lots of episodes, we've talked about the masking. We've got to keep going. We've got to get through our work day. We've got to, or get through the school day. And then you've got activities. And there's just a lot of stuff that we do. And so we keep going. But when we are not attending to what's happening in our body, then yeah, yes, we can go up and get stressed, but we might come back down a little bit. But before we can come down all the way, another and another. And so that constant wave is really, because again, it's what's happening inside our body too, right? The kicking in the adrenaline, the cortisol, and some of those types of things. And then how many people are handling stress really well, right? Because when people feel stressed, especially chronically stressed, are we getting the exercise in?
Probably not.
Some people are.
Some people are.
But a lot of people are not because they're so busy or they're doing these other things. So they may not be getting that.
They're not exercising. They're not eating right. They're not sleeping. They're probably getting cranky with others. They're not handling those relationships with care. Anything else? Did I miss any?
Those were really good.
Okay, thank you.
You've been listening. And so we know that all of these things are happening and we get into these vicious cycles a lot of times. And this is the part about stress, right? That's very different from some of the other things. We get stressed and we know we need to do something differently. Sometimes we know what we should do. A lot of times we're just in the midst of it, right? I sort of think of it as sometimes stress, we know it happens, we're done, it's over with, we're okay. But then sometimes when we think about this chronic overwhelm, it's almost like you can't see the trees through the forest. Like you're in the midst of it, you can't even really pinpoint to one thing that's that stressful anymore because it's also stressful. And there's just not one thing you can take away or do to solve because it's all so much. And so a lot of times, like I said, you can't even see your way out of the forest anymore. And that with chronic stress, that's one of the most important things is that it really it's now just life for you.
Yeah.
And so that's where it gets even more difficult to recover from that chronic stress. It's like we talked about the body's alarm system, which is when you start to feel the heart rate going up, the stomach ache, other, the headache, things like that. And so when your eye starts twitching, right?
It's telling you something's wrong.
And so then when it's on, are we able to go, hold on a second, I'm paying attention. We're doing this self-awareness check. No.
Who has time for that?
Right? Which is part of the issue. Because we have to make time for it. Like the answers to some of these.
But we don't.
It doesn't mean you like need to take a whole weekend off.
Well, maybe.
I mean, don't get me wrong. That sounds lovely. That sounds so
I don't know.
lovely.
I think a beach somewhere tropical can solve a lot of life problems and a lot of life stressors.
It can. It can. And, you know, when you said that, that made me realize, I mean, and don't get me wrong, I absolutely need another beach vacation. But, you know, there is something to be said.
It can create more stress also.
It can. But what kind of life are you living if you have to escape from it consistently just to relax?
Well, if I lived at a beach, I wouldn't have to escape from it.
Right. I know you've got life goals.
I got life goals.
It
involves beach life.
Or lakes or something. No, beach completely.
Tropical.
Okay.
Anyways, I had other thoughts and they're gone now too. Anyways, yeah, the alarms. They're going off. They're signaling that something's wrong. We don't usually listen. Because nobody has time for that. We got things to do. When my eye twitches, you think I just stop? And I'm like, what's wrong here? I'm like, no. Something's stressing me out. That's cool. I don't have time for this.
Right, but I would say with my mindfulness practice, I have now learned to make the time. And I don't always get it right. There's times where I'm certainly have reached that overwhelm part. I know you're laughing at me because you're like, yep. But I am certainly much better at it than I used to be.
But your average person, they're like, I don't got time for that.
I think because a lot of this, people think that you have to like do these big, longer things. Sometimes like
it takes the effort that most people don't have in the moment.
And that's why you've got to be practicing, right? Like I tell my clients, the time to practice free throws is not during the game. Okay, my people who play basketball, they will get it. But the whole point is you have to practice a lot of these skills.
You're in the situation where you need to use the skill.
Yes.
Yeah, I'm not going to do that. But thanks for the advice.
I'm not giving up on you yet. We're going to practice.
Okay.
And I do think a lot of that is through mindfulness. And my thing with mindfulness, though, is I think a lot of what I see is people, like especially a lot of clinicians and even some of the books and apps and things, like they really want you do this for 10 or 15 minutes. And that's what seems very overwhelming to a lot of people.
30 seconds.
That's what I do. I do a lot of those, what I call micro reps of mindfulness. And they're spread throughout my day. And most of them take 30 seconds to 3 minutes. Like three minutes is my minimum in the morning with my first mindfulness, but the rest of mine throughout my day are usually like 30 seconds. We may need to do some future episodes on that.
I don't have time for it.
Yes. Even something simple like this, right?
I don't have an extra 3 minutes.
But here's
time's precious and I don't got it.
And I understand that, and I feel the same way. And when I find myself, because I do the self-awareness checks on myself, and I find when I am most stressed and when I need it more is usually when I have less time to give. And I have also found...
That makes a lot more sense.
It does. And I have found that I am more productive when I make the time to do my mindfulness. And so I actually prescribe myself more when I'm stressed. And when I'm noticing, I'm like, ooh, yikes, that.
You're not selling me on the whole mindfulness thing. I don't think I can do it. I'll stick to like my working out. That's how I feel de-stressed.
And that's a great way to do that. I mean, and, you know, I would probably say too, a lot of the clients that I work with have experienced trauma, especially childhood trauma, complex trauma. So they're dealing with a lot of trauma reactions as well as anxiety symptoms, verging on sort of panic, obsessive thinking.
So they need the in the moment.
They need more. And it's a very specific way that I teach them to do mindfulness that targets some of those symptoms because it's not your traditional, like, we're doing mindfulness just to be calm. No, we're doing mindfulness just so we don't feel like we have a barbed wire fence going off inside our body the whole time.
Yeah.
And so it's a whole different experience. And so that goes back to, the body's alarm system and when they get flipped on. For some, especially when they've had a lot of other chronic stress experiences, such as the ones I just mentioned, especially complex trauma, then they're more likely that their body's alarm system gets stuck in that on switch. And so we have to spend a lot more time and intention on how to control that volume button. So, I mentioned a little bit, part of the body's alarm system is that fight, flight, freeze response. And we talked a little bit being chased by the saber-toothed tiger, right? That fight, flight. And that's a very common response to stressors too. But I think what you asked, that question about overwhelm.
Sure.
Which is, that's where we get into the freeze, right? The just shutting down.
Yeah.
Right? The almost like the paralysis. You can't, I think your generation is calling it bed rotting. Or is that?
I don't know that's from overwhelm, but we use the term bed rotting.
So bed rotting could just be hanging out, just chillaxing.
Sometimes you just need to recharge.
Right.
I can be productive while bed rotting.
Okay. That seems a little like an oxymoron. I'm going to bed rot and be productive.
Yeah, I'm going to lay in bed and not move all day while doing my work on my laptop.
Okay.
I don't got to move to design things on my laptop.
Okay.
Or to edit.
I would not have called that bed rotting. I've been like, I'm going to work from bed. So work from home, work in my bed. I don't know. That sounds wrong too.
Anyways. Yeah, no, I would consider that bed rotting.
Okay.
Yeah.
All right. And so when we think about freeze, like I said, you can just sort of shut down, like just feel like you can't get up and do anything else. And that's where I think the overwhelm, what you're talking about.
Okay.
So interestingly, when you are saying the word overwhelm, one of the things I think of was when I was preparing to go to Liberia, right? Quite a while ago, went to Liberia and trained orphanage care workers and educators after the Civil War. That was like 2011.
You sure? I thought I was in second grade.
No, I remember I was in my doctorate program. So it was 2010, 2011. Yeah. But anyway, as you would say, one of the things as we were preparing to go, trying to get a good sense of, they spoke English, but the word choices, right? The culture that we were going into, and they did not have the word stress. That was not something that they used in their vocabulary. But they used the word pressure. And when they talked about pressure, it was always like pressure.
You're saying pressure. And all of this, the only thing that's coming to mind is you, right before we had started recording, screaming, "Under pressure." Whatever song that is.
Yes. By Queen and David Bowie. Yeah. I don't know that our listeners know yet that I sing.
She sings into the mic before we start every single episode, and I cut it out. It's not good singing.
Not at all.
Sometimes it's more like screeching or yeah.
Yes, but I'm always like, I don't know. It's a mic. I've got to sing. I've got to bust out in song. So anyway, yes, I was under pressure. But they also use their hands with it. And I would say for us, especially when I think about a lot of the clients I've worked with, especially moms, right? A lot of 30, 40-year-olds, and they'll talk about feeling so overwhelmed. And almost always it's overwhelmed up here. Mm-hmm. And so that's a really common feeling that people have.
Yeah.
And so what do we do with all that?
I was going to ask you the same thing.
You were? I don't know. I'm asking you.
What do you do with all of that? You cope? You push it down, you don't feel it, you move on.
No. Let's not follow that. Please note the sarcasm in which she was saying
a lot of sarcasm there. I mean, some people do.
A lot of people do.
I have a theory, and it's not really a theory, it's just a thought. Because earlier we were talking about how some people don't feel stress. And I'm like, do they not actually feel stress, or do they just push it down and choose not to feel it?
I think both can be true. I think there are people who, again, remember, stress is a very individual experience.
Right.
So just because you have a stressor does not mean...
But people who say they don't feel stress at all, like ever.
Maybe that's true.
That's crazy. Sure. I'm not buying it, but sure.
Right. I'm not saying that I buy it either, but there are some people who can do this radical acceptance of things are the way they are, and their response to it isn't going to change it. So why worry about things that you have are not within your control?
Yeah.
And honestly, that's a mantra in a lot of different models when you think about the Serenity Prayer and, a lot of different psychological theories and so forth. Like, people are going to be doing what they're going to be doing, but you may not have any.
You don't have to respond to it.
Right.
Yeah. That's fair. That's valid.
And so different people do different work on themselves. So I think it is possible that people do not feel stress when other people in the same situation might. Mm-hmm. Like, there's a lot of situations that other people find stressful that for me, it's just not. I can handle those just fine. Now, there's other situations where I do experience stress.
Traveling.
I don't know that it's traveling by itself. I think because there's time involved, like especially if I'm traveling for work or things.
Anything that involves time that's not productive.
I might need to reflect on that. There's been a lot on my plate lately. More than usual. But I do think, time is very precious to me. And I want to make certain I'm using it as well as possible. I think getting from point A to point B a lot of times while traveling, because I have been stuck in lots of places at different times. And I'm usually just fine with it. I roll with the punches, but there are things that, especially trying to get out of the door.
Some things just aren't in your control.
They just aren't.
It's okay. Whatever's going to happen is going to happen.
I'll remember to tell you that when you're stressed going somewhere. Like, not on a vacation. You don't get stressed on that, but you do at other times. So I think having a plan, that can really help alleviate a lot of stressors. So we talked about some people experience stress while others may not in the same situations. A lot of times just planning for different situations and thinking about potential problems and what are viable solutions to that can be very helpful. What was it? That was a look.
I don't know, because you're like, all this planning and coming up with different solutions to different problems. Well, how much of that's overthinking? Like
not even a plan A and plan B. Sometimes we have to have a C, D, and E.
Yeah. Because each different event can have so many different problems that you had to come up with potential solutions to. Potential problems with potential solutions. That's a lot of overthinking.
What are you saying?
Overthinking can cause more stress.
For who?
For the overthinker.
Potentially.
On top of the other stress. But also, well, it could also cause stress for others. The people around the overthinker. The stress person, whatever. But also, at what point is how much you're overthinking things and how much you're planning around these potential stressors becomes unhealthy.
Again, I think it's going to be individual for each person.
Right. Yes.
Are you telling me to do my own work?
Every single thing is individual for each individual person. We are not all the same people.
Okay, that said, you want me to... Yes, I do think overthinking to a certain extent...
I wasn't calling you out at any point here, so okay.
I can own my stuff.
Girl, I wasn't doing that, though. I don't know where that came from. Apparently, you felt called out, but...
It's all right. So, I think...
My question was, at what point does that become unhealthy?
I think anytime... Right, the whole idea of what's healthy, what's not healthy is...
individual.
Yeah. But that said, I think it really comes down to when is it disrupting other areas of your life, right? So is that overthinking not allowing you to stay present in your relationship, right? As you're interacting with someone else? Is that overthinking hijacking your thought processes so that you cannot attend to these job or school related types of things? You know, if the overthinking is, I'm thinking about these things and I'm trying to come out with potential solutions, but I can still sit down and have discussions and for the most part, be fairly present. And I can still do my work, even though I might have some thoughts here and there about the problem. You know, that's your subconscious mind that is working some things out. And so those typically I'm not getting really concerned about, except, and this is when the other time when it would be problematic. How much does it bother that person? The fact that you're overthinking, and can you control those thoughts at some point? So for me, do I overthink at times? I'm owning it. Of course I do.
I think we all overthink at times.
Yes. But then one of the things, and this to me is the power of mindfulness, which is I own my headspace most of the time, right? Because I can do my thought stopping and go, hold on, this is a problem that I have to solve, but I'm going to solve this at this time. I'm going to sit down and think about it at this time. And I can attend to the other things that need to be done. That doesn't mean that the thought doesn't creep in occasionally before that time. And I'll just say, oh, there you are again. Yep. That's something still on my mind. I'm making the time to sit down more fully with that. Mm-hmm. So I do think planning and problem solving, in the reason I think that can be so powerful for any mental wellness is there is a proactive element to that versus a reactive. Mm-hmm. Right? Now I'm feeling stressed and I need to react. That's still okay. Mm-hmm. I still have to be proactive, but the more proactive I can be in recognizing these issues and making the time and space to attend to it. And so that's what a lot of your planning is. Mm-hmm. And I'm going to plan, I'm going to solve these problems. I'm going to, these are the things. And so a lot of times when we talk about rebalancing some of our life issues and so forth. And this can be hard if you're in the middle of the forest and you can't see the trees. It can be harder, but you have to chip away. And that is probably where I would say if you have supports and those are still not feeling like enough, then professional help is what I would be recommending because they can begin to help you see some of that and peel back the layers of what might be most helpful for a next move for yourself.
Mm-hmm.
So planning, very important. The other thing that I think is super important when we're thinking about stress, emotional regulation. Yes. Right? Because we talked about like getting snappy at people. Like, how do we know? How do we know we're stressed? Your eye twitches. What else? Do you get snappy? I do. Just a little bit.
I think I get very snappy.
Yeah. Being snappy and irritable, that's a really common reaction. And most of us feel really guilty when we're in that.
I don't.
I mean, I think that's because we give each other space to be like, okay, that's about the person who's experiencing it and I'm not taking it personally. When you get snappy, it's like, oh, you got a lot going on. And we can give each other space. And that's where we're like, what can we do to help each other? Mm-hmm. And, so I,
where's this
one of the things I laugh because like knowing your body clues is really important. So when I get stressed, I had a couple coworkers, they could, once I identified it, they just started laughing because they could see it too. I tend to do a couple of things. I drop everything. Like my keys, whatever's in my hands, like it's like dropping out of my hands, right? And I'm tripping over imaginary things. Like there is nothing on the floor that I'm tripping over, but yet I sort of trip. Those are two, like when I've noticed a couple of times.
She gets clumsy.
Okay, I was just saying I drop things and I trip over things, but
she gets
we'll
very
go with clumsy. Get clumsy. So clumsiness is one of my clues. And so when I notice these things, then that's when I know to I prescribe myself. And when I say prescribes, I'm not that kind of doctor, but I like
mindfulness. She prescribes herself mindfulness. She basically gives herself homework.
I give myself homework. I'm like, I need to do more of these. And a lot of my mindfulness, I'm doing like they're embedded in activities that I do through the day. Mm-hmm. So those are like my body clues. Yeah.
Yeah.
And I want to eat junk. Like the crappy carbs. Oh yes. Like potatoes.
Okay.
And a baked good, right? Like, so all
my
of us.
eye twitches. Mm-hmm. Yeah. And then I get snappy. And other than that, no. I don't have any other signs until I get overwhelmed. Then my brain shuts off.
You shut off. And then you just look at you and you have this like deer in the headlight look. And like, I know the tears are about to come.
There is no functioning in the brain.
There's not. And it's literally a deer in the headlight look with you. Mm-hmm. Yeah.
I've never seen it because I can't see my face. You can't see
yourself, but it is. And so that's another thing, like when we're in relationships with others, like when we're noticing these about each other and like, okay, let's breathe. What do you need? I'm usually like, do you need chicken strips? Coffee? Do we need to just sit down, breathe? Ooh, a heart hug.
I'm never picking the heart hug.
She never does, but she loves it. It works.
No, it doesn't. You gave me one yesterday.
I know. And it worked.
Did it? Because I would not, according to this morning, I would not say it worked.
Well, I mean, it just works in the short term.
Okay.
Heart hugs aren't like long term.
Okay.
You needed I should have given you one this morning.
No, you shouldn't have. No. What happened to consent? I don't consent to heart hugs.
I'm your mom. I'm going to give you what you need. All right. In all seriousness. So the emotional regulation, very real. And that's where social supports can be helpful. Mm-hmm. The co-regulation, right? Things like that. Music. A lot of people use music to regulate, right? You pump up the jams if you're going to work out or, the soothing music to unwind. So there's lots of different ways that we can regulate ourselves with that.
Yeah. All right. Takeaways? Did we talk about everything that you wanted to talk about?
I think some of the other things with coping, what brings you joy?
Oh,
hobbies, the joy in the little moments, like
tanning,
being outside in the sun, sunlight.
Tanning. That's about the only thing that can come to mind right now. Okay.
Right. But we do know that being out in nature, being in the sun, we're not talking about sun levels and so forth. But,
although a UV of a 7 or higher really makes me happy.
Right. Mm-hmm. There's just something about just feeling the changes internally. So I think that those are really important. Like, and where are you finding the little joys in life? Right. Like
my coffee, my morning coffee.
Okay.
That I'm supposed to be doing at home, but it doesn't bring me as much joy or taste the same.
I know I'm frothing my own, and I'm loving the little handheld thing, and I find that I really enjoy the experience. I
really enjoy the experience of going to get coffee.
And hey, if you can afford your daily trips for coffee, go for it, girl. You work hard. And so, yeah, what are our little joys and hobbies and how we're connecting with others? And so I think those are the things, like all the different little things throughout the day that we're doing to cope with our stressors. So I don't know. What are you, my takeaways? You asked me my takeaways. Stress is just, it's part of most of us, part of our everyday world. And so it's finding the little ways throughout the day to manage those stressors, just little things that sort of think like a little release valve, right? So if you think of under pressure, right? I won't start singing it here. But
she got close.
I really want to, maybe after we record. But if we're thinking of like that pressure valve, what are little things that we can be doing throughout the day, whether it's, you enjoy your cup of coffee, like I'm frothing mine, I'm doing a couple of other little things, press that release valve, the pressure valve multiple times throughout the day. And I think that helps tremendously manage our stressors. What about you? Your takeaways?
Stress happens. That's life.
Drink the coffee.
Drink the coffee. Find the things that make you happy and do the things that release the stress. Because stress happens. That's just life.
And I want to add...
And you can't control all the stressors in your life.
No. And I want to add, like, have your peeps' backs. Like, know the people around. know the.
She's old.
I am totally old. Totally old. But the people that are around you that you love, like, we're in this together, and so having each other's backs and helping each other.
Be that support.
Yeah.
Yeah. Bye. Bye.